what our response looks like from week to week. We bring in our stakeholders that are part of the response team that have led the response in Palm Coast and Flagler County. And so we're excited to continue to bring this to our community, to the residents, and thank you for your continued input, as well as the questions that continue to come in. They're really important, for us to also understand what the residents' concerns are. So we're going to jump right into this. So what I will say, first and foremost, is welcome to our panel that is here and continues to be here in City Hall, that is still continuing to be a virtual City Hall, and we'll talk a little bit about that. But we always are joined by our Flagler Administrator, Bob Snyder, Department of Health. Welcome, Bob.
Glad to be here, Mayor Holland.
Thank you. We have our Chief of our Palm Coast Fire Department, Chief Jerry Forte. Welcome.
Welcome, thank you.
Thank you for being here as always. And as well, we have our City Manager.
Good afternoon.
Matt Morton, who is leading many different initiatives in response to COVID, really primarily ensuring that not only our residents are kept safe, but our, how many employees? Of the city?
Over 500.
Yes,
Over 500.
so that is equally as important. And then joined with by the phone with us today, we have our medical director, Dr. Stephen Bickle, who will be talking a little bit more about some of the areas that he's working on closely. Welcome, Dr. Bickle.
Thanks for having me.
Absolutely. And then we're always pleased to be joined by our community partner at Advent Health, our Chief Operating Officer, Wally DeQuino. Wally, welcome.
Thank you. It's a pleasure to be here this morning.
Thank you so much. So first and foremost, Health Department update.
Thank you, Mayor. With respect to the data, Palm Coast and Flagler County, I have good news to share. Statewide, new positive cases are down from 8,826 a month ago to 3,331 yesterday. Deaths overall and new positivity case rates, COVID-19-like illness for emergency room visits statewide are all trending downward. More importantly, Flagler County statistics mirror what is happening statewide. This month, we had a peak of 45 positive cases on August 7th, and yesterday, the 25th, 8 cases were reported. Total positive cases for Flagler as of this morning was 1,275. Other indicators that you know that we track daily are all headed in the right direction, including hospitalizations related to COVID, emergency room visits for COVID-like symptoms, and the 14-day positivity rate, which is 5.1% compared to 5.8% last week at this time, and then 7.3% the week prior, 2 weeks ago. Again, which reflects continued improvement. The RT value, which we talk about, again, which is the reproduction rate of the virus from an infectious person to another, is still less than 1.0, and it is now 0.91. Again, the lower the better for decreasing transmission. Deaths remain at 15 for Flagler County residents. Okay, so this indeed is really good news, but we all know, right, that we are not out of the woods yet, and we won't be until a safe and effective vaccine is broadly administered. Until then, Dr. Bickle and I are pursuing what we think is a game changer regarding testing. We are really enthused about rapid testing technology that is currently available at hospitals, universities, some urgent care centers, and nursing homes, but not broadly available at health departments like ours who are responsible for community testing efforts. When an outbreak occurs, we'd be able to immediately identify folks with the virus during the period of time when they are most contagious and infectious. No one would have to wait 2 to 14 days to get test results back. Unfortunately, a supply chain issue does exist with rapid testing equipment and supplies, but we are endeavoring to overcome this, and I assure you we will. Now, on Monday, our Flagler schools opened, and I just want our audience to know that many public health measures were incorporated in the return to school plan, including facial coverings are required when social distancing cannot be possible. There are many examples of promotion of social distancing, such as the 2 options for virtual learning, as you know, and spacing seating at least 6 feet apart. In addition, there will be a greater focus on cleaning and disinfecting. There's a limitation on visitors. There's signage throughout our schools about hand hygiene, wearing facial coverings, and staying home when you're sick. And again, special messaging to parents to properly screen and conduct health assessment of their children before going to school. And then cohorting of students and teachers at the elementary school level. On September 5th, practice for fall sports will begin with safety protocols in place. A decision has not been made yet about how to accommodate spectators in the stands for football games, for example. This is forthcoming, and at a minimum, the CDC guidelines for social distancing and mask wearing will be required. So what happens when an outbreak occurs on campus? Well, our team of public health nurses and school health staff, led by Stephanie Ear from the health department and Dr. Phyllis Pearson from student services, will burst into action and follow epidemiological protocol that is evidence-based, effective, and well understood by our combined response teams. The health department, we've added 27 staff members, mostly nurses, to assist with case investigation, contact tracing, and teacher-student testing that would occur upon an outbreak, which to us is just one positive case. Yep, it just takes one case to spark an exposure, a probable case or close contact that could result in the quarantine of numerous students, teachers, or staff for up to 14 days at home. Each case will be different. We will closely follow DOH guidelines performing all these epi tasks, similar to when we manage other communicable disease outbreaks like the flu or a GI illness. The bottom line is, I am confident in the ability and competence of our public health and school health team partners for keeping as many students and teachers as safe and healthy as possible under these circumstances. So if you don't mind, Mayor, I just want to pass the baton here to our medical director, Dr. Bickle, because I know he wants to talk about masks as relates to this statistics and the data that I was able to share that is more positive than at previous times. And also I think he wants to talk about rapid tests, especially when we can apply them to school outbreaks. So take it away, Dr. Stephen Bickle.
Thank you, Bob. So I think it's clear to everybody now that we've had a very, very nice, steady, I don't know about dramatic, but certainly substantial decline in Florida and lately in Flagler with our case counts. And even though Flagler's drop happened with a little bit of a lag, we were also at the lowest case rate in the state in terms of counties. So it's not like we were coming down from a high level. So that's a good thing. And I'd just like to bring to people's attention that something that they really should be thinking about is when the RT value is like 0.9, what that means is every cycle, and the cycle is a little complicated trying to figure out how long it is, but it's probably around 5 days. It has to do with incubation period and the R factor and stuff, and sometimes complicated to calculate. But what that means is through every cycle, if you had 100 cases at the beginning and then go through the cycle, the next time you'd have 91 cases when it was 0.91. And then you do that again and you'd have 0.91 times 91, it'd be 82. And then you keep doing that like 5 times and you're about half the rate of about half. So that may take a month or two, or let's say a month or a month and a half, but that's a substantial decline. And in Florida, I think we're about 40% now, levels about our peak, maybe even down to a third. So that's about 8 cycles of dropping about 10% each cycle. So this is a substantial impact when it accumulates. And so what was different? What did we do 2 months ago? Well, the state reversed the opening a little bit. You know, the bars and restaurants, some other things with gyms and things like that. I think that probably had a modest effect, but you know, it's a limited part of the population activity, and so I think that effect was modest. The second one was, did people adhere better to social distancing and change their behaviors? And I give that kind of a plus minus, because for every person who's kind of been doing that more carefully, we have a lot of people who've gotten kind of complacent because we have been doing better. And maybe there's been a slight effect, but I don't think it's been substantial. And if you look at social mobility measures and things like that, it hasn't been a dramatic thing. Well, what is the third one? And I think you know where I'm getting with this, and that is masks. So what happened with masks? Well, 2 months ago, there was a lot of controversy. We were pushing for a state mandate. We didn't get it. You know, I'm not going to fault that. There's a lot of issues involved. But the next thing that happened is a lot of our big cities in rapid succession, Orlando might have been the first one, Miami certainly was, Tampa, Jacksonville, started passing mask mandates. And very shortly thereafter, you know, City of Palm Coast passed a mandate to a lot of resistance. And so I want to just give a shout out to the courage of doing that. And in retrospect, it seems like an obvious, you know, very smart decision, but it wasn't an easy decision at that time. And I'm not doing it just to, you know, pat ourselves on the back, but to explain to people, can we stop the debate about masks? Have we satisfied people enough that you think that's an accident, that our numbers are a lot better? You know, it really, to me, it was a false controversy. The science has been slowly evolving, and it's natural to have kind of a lag between sort of the scientific understanding and then the adoption of it. But I think it's really clear now, and some of the most dramatic studies have actually shown just in the field, does this work? And it does. So I just think, you know, I think we should keep that in mind, that was a big factor. We're doing better, and we shouldn't be stopping doing that. It's a really important component of that. If anything, we're trying to encourage more mask wearing in some of these situations where you may or may not want to do it, like different settings and stuff.
Right, Dr. Bickle, and also we were really pleased that following Palm Coast decision, Bunnell and Flagler Beach followed suit the same day. So together, all three cities and the county's campaign for mask wearing also, I think, had a great benefit. So thank you so much to our governmental entities. So I just want to make sure we threw in the other two cities, Steve, sorry.
Yeah, no, I'm sorry I left them out.
And I'd like to add also, Dr. Bickle, I mean, again, you know, I think the city early on took the approach that we were going to rely on the data and science, in particular our health advisors, to guide us through these decisions, which they were important decisions, frankly. These were times that were unprecedented, and I really also want to thank the business community, because I haven't been to a business in Palm Coast, and certainly since this has been passed, where many of them have not continued to adopt it even on their signage in their windows saying masks are required, please do not enter this building without a mask. And so to that point, I think it's just really taken everyone coming together in this moment and saying, how do we collectively try to continue to stop this transmission and spread, and I agree. I've seen a significant difference. I think the response I've gotten from many residents have been they feel safer going into stores, so I think it's had the effect of helping restart the economy, which is a good thing, which is what we all wanted to see. And so there's a level of confidence there that we hope to continue, because as you mentioned, you know, we really have to get to that point without a vaccine and everything else that this will be a continual process.
Absolutely.
Well stated, and I apologize to Bunnell and Flagler Beach for not including them. It's a Palm Coast forum, and admittedly, the city of Palm Coast did do it first and took the lead. So
Absolutely.
Especially, but there's a lot of people contributed to that. A lot of community members supported it. The business community embraced it. The public adhered to it. So it's really a congratulations to all of us, and it's working. So I'd like to segue to my second topic, which is rapid testing. And I think that what's happening is, no less significantly, there has been a steady evolution of understanding about transmission of the virus, some of it which is still evolving that I'll mention a bit in a second, but it related to testing. And the things that we found out are that transmission is very proportionate to the viral loads in the people who have COVID. The higher the viral loads, it makes sense. The more virus they're spewing out, the more likely it is to infect somebody. One virus doesn't get somebody infected on average. It's thousands of them. So the more you get, the more likely you are to get it. And also some new evidence showing the people who wear masks are less likely to have serious illness because they get less virus if they do get exposed. But anyway, the point of that is that there's a clear pattern between when somebody is shedding virus and what we call their contagiousness or their infectivity. And it's been found that the testing for COVID, there's a couple different types of tests. There are what we call super sensitive tests, which is the PCR test, the RT-PCR test, which detect really low levels of virus, even to the point where it's almost a nuisance at the tail end of an infection because they're still picking up little bits of it when people aren't contagious anymore. And then there's these less sensitive tests, which are still pretty darn sensitive, that don't meet the gold standard for these other tests. And it turns out that they are extremely useful, both theoretically and practically, when you pit them, pairwise, for detecting contagiousness. And the nice thing about these tests is they can actually be done. They can be made to almost to like a home pregnancy test, where it's a strip of paper with a color change, with a precipitant when the antibody reacts to an antigen. Could be done mass-produced. Hasn't been done yet because they haven't been approved, but the technology is like 90+% of the way there that they could be done probably within a couple weeks. They're just kind of hung up now in a regulatory morass. And I think it's going to be such a game changer once it's available. People are going to be kind of shocked. And I just kind of want to go through quickly what we've seen with testing. First phase of testing was we didn't have any. So we had to super restrict who could even get tested. If you hadn't been out of the country or were deathly ill or had high risk for COVID, otherwise don't bother us, we can't test you, you don't even have testing. Secondly, we started rolling out more and more testing of these gold standard complicated tests. Not that easy to do. You had to go to different sites, and the results, there's a big backlog, and so the results were oftentimes delayed 3 to 10 days, which made tracking very difficult. That's gotten a lot better. Availability of these tests is way better. Delays are better, and that kind of fluctuates depending on the demand. Third phase was some rapid testing. I call them rapid testing generation 1 became available. And these are the tests, these point-of-care tests. They involve a machine. They have to be done by healthcare providers. You need a license, a CLIA license, which is a limited lab license. Still kind of difficult to do or difficult to schedule, not readily available, although they can be, like they could be used in a school and other facilities. And some well-financed institutions have been doing them, like the NBA. And they're very useful, but they still have limited capacity because you need the machine. So many you can put through, people have to go to a centralized place. And then there's this second generation, not yet available rapid tests, which I call the true game changer. And they are these cheap paper strip tests that people could buy in a drugstore, or we could have available in the thousands in our schools. And what that would do is we could change from testing people with symptoms or who came for a test because of an exposure to testing mass groups of populations, like all school children, 3 days a week, something like that. And what happens when you start doing that is you start picking up all the asymptomatic cases, or many of the asymptomatic cases in the community that are actively spreading this, because that's how this thing spreads. That's been one of the challenges, in fact, one of the major challenges, is that so many people will get this and then are spreading it before they even know they have it, and we don't pick them up until they've already given it to 2 or 3 people, and then they might give them to 2 or 3 others, and it's just, the health department's done a heroic job of trying to track all this, but it's like with both of your hands tied behind your back. with the testing technology now. So what that would do is it would mean we could be testing all over the county. We could be it in public places, in the schools, in the nursing homes, in businesses. They could even test it in like bars. You can't get in until you test negative. It could change in gyms, things like that. People, or dental offices, you don't get, a lot of the protection we do is because we're trying to protect somebody from exposure, but we don't know who's got it. Well, if you tested everybody negative, and these are very accurate tests, the chance of somebody coming in who had it would be minimal. So you could really change how we do our protection measures, although we're not backing off on masks anytime soon. But anyway, the point is, this is such a dramatic potential game changer that either, the vaccines may or may not come soon, they may or may not be highly effective. Hopefully they'll come soon and be highly effective. But even if that's true, we know this rapid testing strategy works. It's been modeled, it works somewhere between very well and fantastically well. And that would just be additive to this other stuff. So I think we are really pushing it. We're writing letters, we're campaigning. We'll place a bet that we're one of the first 5 counties in the state that has them once they're available, because we are all over this. But we'll put some articles up on we'll make some available so people can read about this. We are grassroots lobbying for this. This might make a difference. The FDA is getting badgered right now about this from a lot of groups. There's an article in Time. The Atlantic had a long article, so it's getting traction. It really could be a game changer, and I want people to think about the fact that for the last 6 months, this has been such a struggle, but there really is a possibility in the not so distant future that we really have a handle on this, where it's not perceived as a struggle.
Well, and we're here to support it. Again, we really want to thank your leadership for being on the forefront of this, and very proud of our health department. And this is just another example why. So, again, we're here not only to support it, we will be sending out information, asking residents to do whatever they can to make sure we're accelerating this. So, just keep us up to date and let us know. I did want to ask for an update for our Advent Health partner, Wally. Did you want to start with your update?
Sure. I would like to continue the topic about testing, because I think that it has a great impact on what we do as well. So we are, actually, the good news is that we are experiencing a little bit more of a relief when we're requesting for test kits for the rapid test that we provide here at the hospital. As Dr. Bickle mentioned, for many months, the supply chain has been very difficult. Also, although we had the equipment, you can only receive a limited amount of test kits for that particular type of test each week. And week by week, you never knew exactly how many you were going to receive. So you needed to be very careful how you were being used. And this is important for me to share because, patients were wondering, why don't we use that type of test for everybody? It's because we didn't have the supply. If we had the supply, it would have been a different story also. So we are experiencing especially for the past 2 weeks, that there is more available. Obviously, it's not infinite. It's not as many as we would like to have, but there is an improvement, and that's a good sign. And as I was thinking when Dr. Bickle was describing about the impact for you to be able to track, etc., I was thinking here about the inconvenience that it causes today for us not to be able to have such type of testing available. For example, we do test every single patient that will go through any procedure in our hospital. But those patients, we need to call X amount of days before for them to show up, be swabbed, and then 2 days later we get an answer, right? Versus coming in, having the test done, and getting ready for the surgery. That's true for any other type of business that today probably they're struggling because of spacing or any other issue where the business could actually be benefited. by having these tests available and having customers come more often versus being more careful about distancing. And the testing is important, but there's, like you mentioned at the end, the hospital is extremely supportive of any type of masking initiative. We think it works, it makes a difference, and I think Flagler County is actually experiencing the results of this campaign. The trends at the hospital continues to go down, as Bob mentioned it earlier. This is encouraging because we did see a drop from the July numbers. It stayed kind of the same for about 3 weeks. Before about a week and a half, we saw a new trend, which was lower than we have seen in the past 3 weeks. And that's good news. Hospitalization is lower. Patients showing up at the ED is lower. We are happy that we're not seeing any signs of flu yet here. That's a good sign. But we're basically looking at what is the new norm at the hospital. So the new norm basically I would say for the next year or so would be a hospital where we would probably be seeing COVID patients either in the emergency room or inpatients. We are seeing volumes of patients coming into the hospital and not delaying their care, which is very good, especially in the emergency room. And we're seeing a lot of patients taking advantage of telehealth. Telehealth became extremely popular for the past few months, and the technology is being used for urgent care type of visits and also for primary care type of visits. And in addition to that, we're seeing our physicians here at the hospital take advantage of that by consulting our COVID patients that are able to through telehealth as well. So I say the new norm, but I am cautious about that because norm doesn't mean that people need to get their guards down. We need to be extremely cautious with social spacing, with mask wearing, and even testing is extremely important. So that is the update from the hospital is that it's good news. The trends are going the right way.
Thank you so much for that update, and again, for all of the healthcare workers within your entire hospital system who continue to keep our community safe as well. And speaking of safety, we have our resident fire chief here that, again, I was thinking about this, Chief Forte, the other night. I know when your team first got together, when COVID, first became a reality, and you put together that metrics of reopening strategies and following the governor's executive orders, and a lot of thought went into that. And I think you were pretty close to being spot on with a lot of the timelines and the time frames and the different strategies, working in conjunction with our health department and the county emergency management as well. So if you can also provide, an update, but also thank you to you and your team. I know Captain Asconi is very well trained in this department. However, I know you guys have conversations that are very fluid and ongoing based on the data that you're receiving as well.
We worked diligently on that matrix back in March, April, with the expectation the worst case scenario would be played out all through the end of the year. And if we were able to shorten that time frame up, the things were in place to actually move timelines forward. And I think just because of where we are, and I'll get into my discussion for today, but the matrix actually was a safety net that we can actually build further out into the year, that we were planning the fourth quarter or the first quarter of the next year of doing reopenings, but we could always shorten it. Seeing how there's different things that have been occurring throughout the whole pandemic, I did some research and found some amazing detail. I went onto the Johns Hopkins website under coronavirus.jhu.edu and pulled up the entire country's performance during the COVID. And if you could envision the country is actually broken into 3 different types of responses to coronavirus. The first one had been hit very hard on the initial diagnosis, so March, April, May, it was running rampant through those states. The second grouping were a flat group of states that they were hit a little bit and they never did peak, they never did drop off, but it remained consistent. And then the third group were recent peaks that have occurred in the last 6 weeks. And those states started off minimally and then rose. And to put correlations in between, it's kind of hard to identify why things happened at the beginning or the middle or remain flat, but there is a constant that you can identify, and it has a lot to do with density of population where people were living in congested areas. So the initial hit in early February, March, April, you see states like Connecticut, Massachusetts, Illinois, New York, New Jersey, Delaware, New Hampshire, Nebraska, and Pennsylvania had the high spike of call volume and the high spike of positive cases between February and April and May. The other states that were peaking and most recently were West Virginia, Florida, Texas, California, Oregon, South Carolina, Montana, Arkansas, Wisconsin, and every one of those states peaked between 8% of their tests or 21%. And what we've noticed is everything is on the decline. We are about half of what we used to be about 6 weeks ago or 5 weeks ago when we hit our spikes. So as Bob mentioned earlier and Dr. Bickle said, we are on a decline, and it's kind of hard to, you hear it every week, we're declining, but now if you go to this website from John Hopkins, you can actually see how the decline is working throughout the whole nation. And just to see how it ties in with the national view, you can pull up the United States on a main program, and you can see the main hit we took in February, March is relevant because you could see exactly where the hits were and the high peaks of where it was, and that's where we started saying we have to flatten the curve and everything has to slow down. So we shut the country down, and then from there we saw a drastic reduction in calls and positive cases. Once we opened up phase 2 in many areas of the country, you can see the spike took off. And now we're coming back to the relaxation part of that curve, or the other side of the curve. And I think this is where we have to go and give a warning is we've just reopened up a new phase. And through this whole period, when Governor DeSantis were opening up different phases of the state, we always watched every 2 weeks. 2 weeks was the catalyst, and we did the parks, and then we did some restaurants at 25%, waited 2 weeks, and we did restaurants at 50%, and then we waited 2 weeks and opened it up at 100%. And we wanted to see where we were getting those big hits or the spikes every 2 weeks. So now we have just come down to a very low point in Florida and in many of these other states that have recently peaked. And what we're going to see is when we open up the schools, we'll see another peak, and then it'll relax back to where it was. So we will see a peak, probably again, a spike, but it's not to be very much of a concern because it's going to relax. Just like the reverse image of the stock market, it plunged and now it's coming back, and you'll have ebbs and flows. I think by looking at the data from Johns Hopkins, you're going to see a big increase in a very short period of time, followed by another relaxation of the amount of positive cases that you're going to see. With that information, we are very optimistic about opening up City Hall. We're opening up a lot of our things over the next couple of weeks, and I think Mr. Morton's going to be ready to talk about that. But as far as public safety, we are cruising at that high altitude. We had minimal cases throughout this whole. We've had our third case, and he's coming back to work on Saturday. We're very happy with our response and the equipment that we are using, and we're doing well.
Yeah. and-
Here, I have a question for the chief.
Absolutely.
Chief Forte, when you looked up the Johns Hopkins information, excuse me, you had mentioned that, we're possibly anticipating a peak here in the future. Did the Johns Hopkins researchers, did they seem to think that a peak would be related to reopening of schools around the country. Is that possibly a basis for their thinking?
This is basically off of lagging data, so it's up to, this is as current as Monday. So they're doing daily testing and recording everything daily, but every time that there is a change, there's a influx in cases and positivity, and then a relaxation right after. So the next thing that we're doing is we're opening up schools, and how we deal with the opening up of schools is going to be a big difference between a large spike and a small spike.
Right.
But it's just like when we opened up restaurants and we opened up the healthcare centers and the facilities for fitness. You'll see a big change, and then it'll come back down to a normal again.
Yeah, I agree. I mean, again, you know, it's something, you know, we have to do. We have to keep assessing where we are. Speaking of reopening strategy for the city, and before, you know, you give your update, Matt, it just, again, we also want to say, I'm sure you can agree, Chief Forte, you know, our thoughts and prayers are going to be with Louisiana and Texas in the next how many hours, who may be sustaining some pretty serious conditions. So please keep them in mind as well.
Absolutely.
So Matt, would you like to give the city update?
Absolutely, thank you. You know, first thing I want to mention is we've heard it several times, and while we are seeing better trends across the board in terms of flu and COVID-like illness and admissions, we're seeing, you know, downward trends or relaxations in curves. We still need to be vigilant, and to drive that point home, as of this last week, we had a city employee in the ICU for 2 weeks with COVID. So my point is, yes, it still is very serious, and so we're going to be mindful of that. Not, again, as we said way back since March, we're not operating out of fear. This is not a knee-jerk, Mayor, you pointed out again. Every time it's been about the data, it's been about the science, it's been about this tremendous collaboration between our health partners at the health department and with Advent Health, our fire department and chief and the command staff, city staff, our council, our mayor, making sure we're making good decisions. And so with that being said, we feel very comfortable, and no sarcasm at all, barring anything major occurring. We have a hard opening date. We will be opening City Hall on October 5th, which is a Monday. We have in place all kinds of new measures, as I'm sure by now would have been novel several months ago had we opened earlier. Now I think people are very used to these measures. We're going to have in essence, sort of a concierge to help guide you when you first get here and understand where you need to go, so you can limit your time and exposure and get served more quickly at City Hall. We will have screening measures in place, as we've mentioned throughout this process. You'll be required to wear a mask. There'll be a temperature check, wristband, you know, answer those health questions. Have you been exposed to COVID? Do you have a temperature? You know, are you feeling well? Those types of those three basic questions we're asking. But there's also some changes you're going to notice in City Hall that are new when you're welcoming back in. One of those is there's glass in places there wasn't glass before, and some of those are barriers, not to service or not to our friendliness, but just those barriers that prevent airflow or other things, and those have now also become standard in many places they weren't before. We tried to be tasteful and respectful and do those things. We're going to have a walk-up window here shortly out front of City Hall. It's great for a couple of reasons. One of the things we keep talking about with the council is, you know, traditionally City Hall itself is very good at bankers hours. We're good at serving at bankers hours. And every time I go to the county courthouse, I notice after hours that window has a line, because a lot of folks can't get here during bankers hours. They have jobs, they have school commitments with their kids and family. So that's going to allow us now to have service with extended hours to our community. So there's some, again, good developments, things we're trying to make all work together for the continued excellent level of service I know we owe our community here. So what will start happening in the next 2 to 3 weeks is we will start rotating staff back in. There's still going to be a lot of folks working remotely, but staff will start coming in. IT has a tremendous job. We very quickly, in a matter of 3 or 4 days, checked out dozens of machines and laptops and desktops and set everyone up to work remotely. And now we have to create that balance of how many people are in the building and what equipment do they use. And so we're going to start this transition and make sure we're ready. Over the next couple of weeks, you'll see that. Partnered with that will be some soft openings at some other city facilities. We're trying to have one unified approach to say, the city is here. You don't have to wonder, is City Hall open today, or is utility open today, or is someone going to be staffed at the community center? We'll have this one coordinated approach, again, all being forward-facing on the 5th of October. There'll be a lot of communication coming out of our communication department about specifics and where you can have questions answered. There's a lot of frequently asked questions already and some great updates that are being pushed out through our virtual town hall and Palm Coast Connect. You can always email those questions too if you don't want to browse the frequently asked questions database, which is phenomenal. Be happy to send you specific information on your specific concern or how we can help you. But I think staff and our community are looking forward to having those, again, as Tommy was very fond of saying, and I love quoting, we literally were delivering 97% of services. That little percent we weren't delivering were ones that are truly, I think, discretionary, with the exception of the Plan Use Development Board meetings, which are also going to resume in September, so just in a couple of weeks. They're going to be kind of our pilot. How do we get, 50 or 100 people back in the building? What do we do? How do our measures really work? And so, again, as we've always been, strategic, coordinated. We've maintained our cleaning and sanitation measures and our distancing approach. I believe in face coverings, have from the beginning. Very proud that our mayor came right out of the gate very early on, and Dr. Bickle, you nailed it on the head. It was not an easy decision back then. I remember the concern and the frustration, but doing the right thing is always something I've seen our mayor do. And here we are today, a few weeks from an opening, and we're very pleased to sort of get the rest of this back to normal. Now, one of the questions I did get was, why didn't we open the first of this month to coincide with schools? And that was also a strategic decision to give that gap. Instead of opening two very large institutions at the same moment in time, we figured that our community, our teachers, our families, we have again over 500 employees and many of them with school-age children. Let's all figure out that new rhythm of what the bus routes look like and the new drop-offs and the new protocols of clubs and before school and after school, and let that be a little bit of a community bellwether, which that is happening now. And that will help inform any last little decisions we want to make or adjustments we need to make sure we continue to be a community partner. And so very comfortable with that and looking forward to, again, very strategically continuing to open up and fill those last little gaps we have.
Yeah, I mean, a lot goes into this, as you know. It's why we have great partners as well. So I have a question before we get into a couple of the school questions. This is for Dr. Bickle, because I brought up when we were talking about the mask mandate, I have a friend who tested positive, and some of the residents were inquiring, well, how do you know they tested positive at a store that I mentioned? And, they were asymptomatic, had no symptoms, they were getting ready to travel, a test was required, came back, they tested at a very high viral load. Their two children tested positive as well. But can you explain a little bit about the fact of if someone is, again, asymptomatic, they're testing at different points. They said that obviously the test, very uncomfortable. It's not a comfortable swab test to go through. However, they can track back where that person was based on how they're testing, how many days, right, they've been, just based on the number that it's coming back on. And so I think it's important, again, to residents to know they can be out there feeling fine without symptoms and have COVID, and we're seeing that more and more. However, that goes back to that contact tracing, that communications, how that starts. So Dr. Bickle or Bob, can you really just, hone in on that with a little more detail for the residents to understand there is, again, a direct correlation on how this process works and why.
I'll go ahead and start, Steve, and then you can continue. Yeah, so 40–50% of all the cases, the studies tell us they're asymptomatic folks. And so whether you are a positive case with symptoms, whether you're a positive case and you're asymptomatic, the case investigation and contact tracing efforts are the same, because you are a case. And then we even treat those close contacts as probable cases. Thus, it's so important that through contact tracing, someone who has been exposed to a confirmed case, again, for more than 15 minutes for close exposure, that's treated as a probable case. And until when even if that person gets tested, we want that individual to stay home for 14 days. And that's how we're able to break the transmission of the virus. So whether symptomatic or asymptomatic, case investigation, contact tracing for the most part is the same process. And because the asymptomatic rate is just so high, and that's how it's transmitted to so many people. Steve, do you want to continue?
Sure. You know, one of the big differences in why it's so much harder to control is SARS-CoV-1, you know, COVID, versus SARS-CoV-2, which is COVID, versus SARS-CoV-1, which was the SARS outbreak in the early 2000s, is that viruses have their own patterns, and people with SARS-CoV-1 were deathly ill for the most part when their viral loads were high. So they were in bed or in the hospital. They were not out in the community transmitting. Once their viral loads were up there where they could be transmitting, they were mostly in bed. Whereas this is almost the opposite. And we're going to start posting some material on Palm Coast Connect. Tyra and I have been working on this that you can look at for reference. But if you look at a curve of viral loads in the course of COVID illness, what you'll see is if somebody's exposed on day 0, and then you start tracking how long it is till symptoms, and how the viral load goes through that course, they don't get symptomatic on average until about day 5. But they start having pretty substantial viral loads about day 2 or 3, and they actually peak about day 5 or maybe day 6. And then they go through a slow decline for the next week or so, to the point where about 7 days on average after they become symptomatic, they don't have culturable virus for the most part. So your infectious period runs between about day 2 or 3 after an exposure to day about 12 after exposure. So a couple days pre-symptomatic and then 7 to 10 days post-symptomatic. So that's the contagious period, and that's what we're talking about, these rapid tests identifying. Now, COVID is pretty contagious, but it is not super contagious. Measles is super contagious. You walk through a room with measles, if people aren't vaccinated and immune, they get it. With COVID, it's not like that. Measles, the R factor is like, before it gets adjusted for other factors, it's like 15 to 20. For COVID, it's like 2.5 to 3. So it's pretty contagious, but that's why they keep talking about prolonged, you know, relatively long exposure, like 5 to 15 minutes indoors without a mask. That's kind of the realm, and really even 15, where people are likely to get it. So that's why not all family members even get it. And then the other thing is when people, and we're still kind of sorting out how contagious kids are. That data is a little bit unclear at this point. So there's some other factors there, but the point is that the contagious period includes a couple, on average, 2 or 3 days when you're asymptomatic, and then another week or so when you're symptomatic. And then after that, even if the sensitive tests pick up virus, it's thought that it's either too low an amount to actually infect somebody, or it's not actually full virus. It's particles of virus shed out of cells and things like that. So does that help?
Yeah, it does. You know, because again, I mean, I think a lot, you know, has sort of from the beginning of this, the more we learn, the more we understand, the strategies have varied because of the information we're receiving. So it's just important, you know, to walk through it for our residents to know how this is transmitted, why, when, and again, that asymptomatic is a critical part of that.
Oh, it really is. I think it's one of the reasons that this virus is so different than others is because the asymptomatic rate is so high.
Yeah.
So high.
And you know,
One other point is, if you look at the curves of these viral loads and think about when people are getting tested, we're probably missing on average about 2/3 of their contagious period.
Wow.
And that's why it's so hard to contain this.
Wow, okay. Well, that makes a lot of sense. So a few questions have come in regards to the schools. We want to make it, known to the residents next week. We will have our superintendent of schools that will be on our virtual town hall speaking about the reopening, how it's going as well. So I think that'll be very helpful. But there are really important questions that came in, and I know, Bob, you've taken the time to get some definitive responses to. Did you want to take those?
Sure. So one question is, are the citizens of Palm Coast going to will they be made aware of COVID cases at the schools? Well, the answer to that is going to be yes. I learned early on when this virus hit our communities. Relatively speaking, we're 113,000 people in Flagler County. The majority live in Palm Coast. Compared to Miami-Dade, Broward County, we're relatively small. And I'll tell you, word gets out, word spreads about many people who have tested positive. They contact their employer, and it makes no sense for any of us to say, well, I'm not really sure. We're not breaking confidentiality rules or anything like that when we know that something has happened, something is out there by way of a case, or an employer being aware that there's someone in their employee who has tested positive. So it makes no sense at all to not admit that, a place has had an outbreak. And I can tell you, when there's an outbreak in our schools, not a matter of if, the community is going to know, because parents are going to know, teachers are going to know. Social media, as we all know, is a very powerful communication tool. And so it makes complete sense, everyone, to be transparent and honest, so that when there is an outbreak in a large congregate care setting like a school, word's going to get out. And so we're just going to be honest about that.
Yep.
And to let people know and be aware. This continued question here is, I feel it is our right to know about any increase in cases and, not giving out names, numbers, or anything like that. But this person says, I don't see it displayed visually anywhere. What and which schools and the methods by which the schools are sanitizing the buildings? I know that disinfecting, sanitation, cleaning has taken on a whole different meaning within the school system. We've discussed that with the superintendent and with David Bosserdett. So when she is a guest, I think in a couple of weeks, I think that would be a good question for her to get a little bit more detailed about.
I agree.
So
Yeah.
we can ask her then. And then next question is, who's responsible for sanitizing the desks and chairs in between classes? I checked with the school system this morning, Melissa, and that sanitation in between classes is not required, but cleaning supplies are available to teachers if they wish to do so in between classes. Next question, are you sending in custodians after each classroom full of kids when they depart and prior to the next classroom full of kids? Well, the answer is no, it's not required, as I just mentioned. Follow-up here is, I know teachers do not have enough time between classes to do this. Do you even supply teachers with proper PPE, masks, disposable gloves, etc.? And the answer is absolutely yes. They are provided with all the PPE that they need. If we're running out of that between the county and health department, we will make sure that they have supplies, including cleaning supplies.
Yeah. Yeah, and speaking of that, you're still in partnership with masks. Where are we with distribution of masks? Are we given out all we have?
Well, yes, we have about 184,000, and we've ordered more. So we're expecting another 67,000 of masks to come in any day now.
Wow.
Yes.
And it's a great partnership with the fire department as well.
We've done what we call the Halloween Bowl. We put the masks out front in small quantities, so if someone wants to come up, they take a couple that they need. We'll go out periodically and replace the Halloween Bowl. and make sure that they have at least masks, because there's no guarantee that the firefighters are going to be there, and we don't want them to have to wait to come in the building to get a mask. So we're monitoring it closely, but we still have some of those masks left.
And Mayor, I just want to point out also is that our custodians, the janitorial staff, excellent group of folks. They do a really big, deep clean at the end of each day for all of our schools. So a very hard-working group, and that's very important.
Want to make sure we say thank you to them. Wally, I have a question for you in regards to visitors at the hospital, and what is the proper protocol, the protocol that the Advent has instituted, and where are you at with that?
That's a very good question because, you know, as times goes by, people tend to forget what we have in place. We continue to allow only one visitor per patient per day. And again, the idea behind this is that we need to minimize any possible impact of any contamination from people that are asymptomatic walking into our hospital. So we're protecting not only the patients, but also our staff, so they are able to take care of other patients. In the emergency room, well, we normally ask the visitor or whoever is coming with the patient, if the patient is not a minor, and if the patient doesn't need any assistance from the family member of the visitor, that they wait in the car until we have the patient in a room, in the emergency room, and then we will call that visitor to come in and go straight to that room. We're doing this to minimize the number of people in the waiting area in the emergency room. We want to allow the emergency room waiting area to be occupied by patients only, or patients with people that are given the support that they need. And for the physician office side and the outpatient side, we're also allowing one person to come in with the patients.
Yeah, that's really important. And again, thank you for helping continue to keep our community safe with those protocols. We wanted to also mention, you know, on our social media challenge pages, we are and have created a campaign, the Mask Up Palm Coast campaign. So if any of the residents want to share their creative masks and to take a selfie and demonstrate their support of mask wearing in our community, we're asking you to take that challenge to be part of the solution. I've seen some creative masks, again, so have fun with it. But it's a great way to share, you know, your participation.
We're
in
kind
this.
of boring up here, Mayor. I don't know if our audience can see, but we're kind of plain
Yeah.
Janes up here with our masks. So we got to step it up a little bit.
That's right.
I'm fashionably wearing generic underwear.
I've heard that quite a bit, actually. Yeah, no, you're right. I mean, like, you know, again, it's an important issue, but, you know, no reason not to be creative and, you know, show your spirit. I think I've seen, you know, the Sheriff's Department has sort of a brand. I know our first responders have stepped up as well, which is great. So, you know, we're coming to a close of this virtual town hall. You know, I would like to say a continuation of a big thank you to our stakeholders and partners, but really to the residents of this community. Mm-hmm. I think it is a collective thank you from each and every one of us that are sitting up here. Our numbers are the way they are because of you.
Yes.
There's no question about that. The data is demonstrating not only your support, your continued diligence by being out there, socially distancing, you know, hand washing, mask wearing, all of those things. So let's continue to do that. You know, let's make sure we're continuing to hear the accurate information that's being supplied and supported. There's a lot of avenues to get this information. So continue to tune in, ask questions next week, as I mentioned. Obviously, a major topic is going to be the schools. I think you're going to see additional information on our wastewater testing. We're coming up with some more information that's concrete to share with the residents that will be open to the public. So you will have that information at your disposal as well. So stay safe, stay connected, and we'll all get through this together.